question?
Okay.
Lecture 5 and 6 are a week apart. Lecture exam 5 and 6 are a week apart.
Okay.
And lecture 5 is 3 chapters, but you're going to have both of them.
That's right.
Last semester you usually pushed out the due date already. What we knew we were going to do that.
I usually give an extra
I know we're going to have open book session.
That's correct. All right. So we're going to start with the erectile bodies of the penis. The erectile bodies are, I said this before, I think, highly vascularized, smooth muscle. When I defined erection, I said that the penis becomes engorged with blood, and these are the bodies that soak up the blood. So what you have is one, corpus spongiosum. Let me point it out to you. It's this structure. It's the ventral aspect of the penis. This whole thing. They've dissected it apart from the other erectile body. They're together. What you can see from this picture is that proximally, the corpus spongiosum forms the bulb of penis. Forms bulb proximally. I'll say forms bulb of penis, which should be complete. Forms bulb of penis proximally. And distally, it forms the glans penis. Now, so if I point out these structures, there's the bulb, and then there's the glands. Okay, but the whole thing is corpus spongiosum, erectile tissue. The other erectile body is the corpus cavernosum. Oh, actually, before I move on, there's one thing you can't see that I want you to know about this corpus spongiosum. It contains the spongy urethra on the inside. Contains spongy urethra. It used to be called penile urethra. Basically, it's the part of the urethra in the penis. Okay, moving on to corpus cavernosum. The corpus cavernosum, I'll describe it as paired dorsal bodies. Usually I read it in books. Erectile tissue that's paired. Dorsal, meaning they're on top. Bodies. So, when you separate out the corpus spongiosum, it's easy to see. They are paired, and they diverge as you get to the root of the penis here. So where it diverges here, like little legs, these are called the crus of the penis, the part that's attached to the pelvis. So I'll put diverges, forming crus of penis. Now, crus means legs, the little legs of the penis. During an erection, both erectile bodies become engorged with the blood. The corpus spongiosum, it remains soft during erection. It's the corpus cavernosum that becomes hardened. Remains soft, hardens. On the next slide, there's additional labels to the penis. They show body and root of penis. Now, the body of the penis, well, that's simply the part you can see. It's the root of penis, can't see it. Can't see. It's the part that's attached to the pelvis. It's on top of the UG diaphragm. Here's the deep transverse perineal right there. That's the muscle of the UG diaphragm. And notice at the root of the penis, the erectile bodies are covered with what are called the erector muscles. So the root, erectile bodies covered by the erector muscles. Those erector muscles are the ischiocavernosus, the bulbul spongiosus. Okay, erector muscle. So it's the bulbul spongiosus that covers the bulb of the penis. Okay, so associate the bulb of the penis with the muscle called bulbospongiosus. We've noted that muscle before. Here, the picture shows it covering the bulb. And covering the crus are the ischiocavernosus. It's a long word, ischiocavernosus. So the ischiocavernosus covers the crus, the bulbul spongiosus covers the bulb. I'll show that to you on the picture. This muscle here covering only the root, bulbul spongiosus. On this side, covering the crus, ischiocavernosus. On the other side, it's uncovered. So they show you covered and uncovered in the root. Okay, and notice how the muscle stops here. So the part you can see, the body of the penis, there's no erector muscle. So, I mean, they call it erector muscles. The function of these muscles is to help maintain erection. So when they contract, they squeeze. And in doing so, it's like you're keeping blood in the penis by squeezing at the root to help keep blood in the penis to maintain an erection. So that's their function. I mean, I don't even have to write that down. They call them erector muscles. So the function is to maintain erection. So if I put these pictures all together, if you study the penis in cross-section, body versus root, what I want you to see is that the body, we have paired dorsal bodies. The blue tissue is paired corpus cavernosum. So around there, the blue tissue is the corpus spongiosum. Look at the root. We still have our paired corpus cavernosum and our singular corpus spongiosum. Right in the middle there, you have arteries. the arteries that supply blood to the erectile tissue. So it's right in the middle, so the arterial blood can engorge the penis with blood during an erection. There, that holds the urethra, the spongy urethra. And notice how the muscle, ischiocavernosus, bulbul spongiosus, it's pictured here but not here, right? Because you don't have it in the body. So, okay, so let's see if you just heard that. Is this body or root? It's the body. This is that. Same thing. They call this the monkey face. Kind of resembles a monkey face. But you need to know blue tissue, corpus cavernosum, corpus spongiosum. I guess that will be the mouth of the monkey right there, the spongy urethra. One thing is you have veins up here. For example, the deep dorsal penile vein. What happens is, as these fill with blood, they collapse the veins. That's another way you help maintain erection, because veins are draining the blood out. So if you collapse the veins, you help keep more blood in the penis during an erection. The other thing is I want you to know that the spongy urethra is lined with a transitional epithelium. That's the histology there. Lined, spongy urethra lined with a transitional epithelial tissue, ET. Okay, that's the notation there. If you look at a close-up view of this epithelial tissue, and you tell me, is this stratified or simple, the transitional ET? Stratified. It is stratified, many layers. Histologists thought that this tissue represented a transition between stratified cuboidal and stratified columnar, so hence the name transitional, that's what we call it. It has an ability to stretch, right, because it has to accommodate urine passing through. So anyways, moving on. Any questions on the erectile bodies or anything? I'm going to move on to the next topic, which I call the male duct system. I want to talk about the journey of sperm from testes all the way out of the penis. And a simple memory jogger, 7-Up, well, it's really an overview. Seminiferous tubule, epididymis, vas deferens, ejaculatory duct, N is nothing, urethra, penis. And so to kind of take you through this, I just want to write down all the structures sperm must move through to exit the body, starting with the testes. Journey of sperm, the male duct system. It starts inside the testes, and what we had talked about are the scrotal layers all the way down to tunica albuginea, which has all these little infoldings called septum, which create all these little compartments. That's where the seminiferous tubules are, and that's where the sperm are made. So let's start with that. Seminiferous tubules. Seminiferous tubules, and after that, well, what I did was I included a picture that just has the ducts, nothing else. That's this picture. As you can see, the seminiferous tubules converge onto this little net-like structure called the rete testes. Rete means net. So that's the next structure to list. we're still in the testes. This is the retate testes. To get out of testes into the epididymis, there are several efferent ductules that will lead to the head of epididymis. All right, so the efferent ductules lead to the epididymis, D-I-D-Y-M-I-S. Remember, there's a head, body, tail of the epididymis. When you get out of the epididymis, there's this U-turn right here, where epididymis becomes ductus deferens. Now you're in the spermatochord. Remember the ductus deferens. It's contained within the spermatochord. You can just follow that up. Remember, the spermatochord is about 18 inches. Here's a picture of if you were to sterilize a male, that's how you do it. Vasectomy is cut and ligate that too. Easy to do. Well, I shouldn't say easy to do. It's easier to get to for the urologist. You don't have to be hospitalized. You can do it right in the urologist's office. It's outside the body cavity, so it's not major surgery. But this is a Repro lecture, so we don't want to talk about this, but I just wanted to give that at least one slide to mention it after you sterilize a male. Because if you do that, the ejaculate will have no sperm. All right, you can follow the spermatochord from the scrotum. It's got to go all the way through the inguinal canal. Okay, it's going to go over the. I'm sorry. Kill myself up here. Remove that. It's going to go over the bladder. It's going to go behind the urinary bladder. There's the ureter, which transports urine to the bladder, but we're not concerned with that. We're concerned with this. This is the end of ductus deferens. When it ends, it widens right there. Right there. This is called the ampulla of the ductus deferens. So we've gone inside the body cavity now, right? So now we're in the posterior bladder. That's the urinary bladder. So we're in the ampulla of ductus deferens. And this is also the slide that we use to teach the seminal vesicles, the other glands that secrete things into the semen. And I'll come back to them. I want to stay focused on the journey of sperm. But this is kind of where the sperm is going to get mixed up with all these other secretions to help it on its journey out of the body in the female reproductive tract. So now we're looking at a model of this picture. This model is right over there. We're going to have time to study models today. I mean, there's the prostate there, the prostate there. That's where we go next. The next duct is actually inside the prostate. And it's in a structure called the ejaculatory duct. Can't see it here. Let's go to the next slide. The ejaculatory duct is inside the prostate right here. So that's the next structure to list after ampulla of ductus deferens. Ejaculatory duct. Okay, you might want to note to yourself, it's in the prostate. That's where it's located. And pretty much, we've moved sperm all the way from testes to inside the prostate. And the next thing is the urethra. So by definition, all of this is emission. So this point represents end of emission in terms of how I defined it in class. End of emission, which is movement of sperm up to the urethra. So that's it. The ejaculatory duct, and next thing you got is urethra. So this slide, the red arrows are pointing to the openings of the ejaculatory duct into the urethra. So here's the ejaculatory duct, the little canal, or the little duct. Right where it opens, that's the opening of it into the urethra. So these little dots there, the little paired dots, those are the openings of the ejaculatory duct. So to go back a slide, this is the full view of urethra. Prostatic, membranous, spongy. Okay. So those are the three parts of the urethra you got to know. Remember, ejaculation is movement of sperm out of the urethra. So first, prostatic, urethra, membranous, urethra, and then spongy urethra. The part that's in the penis. It used to be called penile urethra. Okay. Now, a little note for membranous urethra. That's the part that pierces the UG diaphragm, the deep transverse perineal. Pierces deep transverse perineal. And when you get to the end of the spongy urethra, there's a name for that. It's called the external urethral orifice. You got a label right there. I'll just kind of add that to the end there. External urethral orifice. That's pretty much the end. It's movement of sperm out of the urethra. That's ejaculation. Now let's remember that the sperm has to mix with the other seminal fluids to help it along its way. So let's talk about the accessory glands that contribute to the semen volume. You can start to look at this picture and just kind of name the glands. Now before I erase this, you have any questions on the journey of sperm? So, let's say something semen. A typical ejaculate, it's about 2 to 5 mLs. And the most important ingredient in the ejaculate, in the semen, is the sperm, obviously. And you should have about 20 to 100 million sperm per mil. Okay, in a fertile man, that's kind of the average high-low normal range. Okay. Now, mixed in with the semen to help the sperm along its journey are these 3 accessory glands. Anything they tend to use the word accessory, you're secreting into the urethra, but you're not part of the urethra. Okay, you're just secreting into it. You're not a part of the duct, but you secrete into the duct. You have access to it, your accessory. So the first one is, how about prostate? That's what I got here, prostate gland. Well, it surrounds the prostatic urethra, so obviously it secretes into prostatic urethra. Now the secretions are slightly acidic. Contains citrate. That's what makes it acidic, like citric acid and OJ. You need that for the cell metabolism. And this slightly acidic secretion, again, secreted into prostatic urethra. It's right below the bladder, okay? It is prone to cancer in males. All right, next one. The seminal vesicle is the larger of the three, and notice how it's going to share the ejaculatory duct with the ampulla of ductus deferens. So seminal vesicle. Now this gland, called seminal vesicle, it's about 60% of the secretions of the ejaculate. So that's basically the biggest contributor. And it has a thick yellow kind of alkaline fluid. It's going to neutralize some of the more acidic things, for example, in the female reproductive tract. That's all I'll put, alkaline secretion. Just be able to identify that. And then you have the tiny little P-shaped, I label it with a green arrow down there. That is the bulbourethral gland. Bulbourethral gland. This will secrete a clear alkaline mucus that will neutralize trace urine in the spongy urethra. Neutralize trace urine in urethra, in spongy urethra. The name can tell you where to find it. Bulbourethral. Look for it next to the UG diaphragm. Look for it next to the bulb of penis. Okay. Some of our models do show it within the UG diaphragm, right next to the bulb of the penis, bulbourethral gland. So in terms of all the other important contents of the semen, just note this slide. I just kind of listed a few things. Fructose and citrate, prostaglandins, they help smooth muscle contraction. Because fertilization, sperm and egg, will occur right here. On day 14 of a 28-day cycle, essentially a mature female will have ovulation, where the egg or oocyte literally bursts out and is caught by the uterine tube. And there it can wait for about a day for fertilization. So in a typical 28-day cycle, I'd say you have about 2 days. Depending on who you talk to, maybe they'll say 3 or 4, but I think 2 days is the best opportunity. Day of ovulation or day after. It's just waiting there to be fertilized. So if the ejaculate is here in the vaginal fornix, it has to swim from there to there. And I've read in books that it could occur in about 5 minutes. Okay, I don't know how they timed that one, but that's what I've read. Okay, boom, boom. Okay, and so all of these things can help the sperm along that journey within the female reproductive tract. Prostaglandins will cause reverse peristalsis of the uterine smooth muscle, so it'll help wash it up there. Because that distance, it's not very long, but a cell can't swim that far by itself, so it needs help. There's relaxin to increase the sperm motility. I said the seminal fluid is overall alkaline because the female reproductive tract is very acidic. There's an antibiotic called the seminal plasmin, and there's fibrinolysin that will free the sperm from sticky semen so it can fertilize the egg right here. That's the typical site of fertilization in the oviduct. So fertilization doesn't mean you're pregnant. Fertilization, we'll talk about the details of that later. It occurs here, but the fertilized egg will remain here for about a week, okay, maybe 10 days. And then 7 to 10 days later, it'll make its journey into the uterine cavity for implantation, and that's pretty much pregnancy. So the details of that are in the next chapter, but this is a good transition from male to female reproanatomy. So that's what I'll start next. start with our sagittal section of the female reprogenital urinary region. That's this picture here, cut view. And then I put a dissected out view of all the female reproductive structures there. And I give you a page number, you can look up both. But and to give you an overview of the female contribution, I think for male I gave the 3 E's. For female I call it the 3 receives. And I got it boiled down to that. Just to give you a general idea how the female can help us reproduce. So the first thing that must occur in what I call the 3 receives, ovulation must occur. So I'll say that the uterine tube must receive an ovulated oocyte or egg. Now the uterine tube is also known as the oviduct, or an older term, fallopian tube. Okay, so basically that tube, that's my first receives, must receive an ovulated oocyte. That's the proper name for egg in this class. And that, remember, that's day 14 of the ovarian cycle. Day 14 of a 28-day cycle. That's the textbook average. That must happen, okay? If you're not ovulating for whatever reason, that female cannot reproduce. Ain't gonna happen. And there's no guarantee that the uterine tube will receive it. The ovary appears pink, but it's all scarred and pustulated owing to many ovulations, about 1 a month. They take turns. That's my understanding. If it's ovulated in the peritoneal cavity, you're probably not going to fertilize there. Even if you did, it wouldn't really take. The ideal thing is to receive it in this ampulla of the uterine tube. That is the typical site of fertilization. Let me write that down. The typical site of fertilization is the ampulla of uterine tube. All right, so right there. Okay, so if that happens, if that were to happen, then my second receives is the vaginal fornix must receive the ejaculate. So obviously this is a prerequisite for fertilization. Okay, so that's my second receives. So then, and if you accomplish fertilization, then the third receives is the uterus must receive the fertilized blastocyst. That's kind of what you call it before it implants, the fertilized egg. Uterus must receive blastocyst. Again, that's the fertilized egg. For implantation. The details of fertilization and implantation we'll talk about, and those are crucial things. So let me underline the crucial things. So this is our third receives. you must ovulate, okay? That's crucial. And then if you ovulate, you must fertilize. And if you fertilize, well, then you must implant. And they all have to occur in that order, okay? And there are contraceptions, for example, like take the pill every day, it's female hormones. They inhibit the gonadotropins, so you don't even ovulate. If you don't ovulate, you're preventing fertilization. There's other things like the implant, the intrauterine devices, this copper and transition metal. That will allow for fertilization, but it will prevent implantation. So there are different ways that females, if you want to prevent repro, you can. But I'm not going to teach that because this unit is reproduction. So we want those things to occur. All right, so that's my overview. Any questions on the 3 receives? I'm going to talk about the perineal region. The perineal region, like for the males, I showed this picture, that picture there. Notice that the bike seat is wider because the female pelvis is wider. Okay, but it's the same things, anal triangle down here, UG triangle up there. And this, if you dissect away the skin, you can see some of the same muscles that we talked about for the male. So let me relist them here. So if you just dissect away the skin all the way down to the muscle of the UG diaphragm, UG stands for urogenital. Anyway, the muscle of the diaphragm is I'm going to put deep and superficial. Transverse perineal. I'll point them out to you. The deep one looks more like a flat membrane there on either side. It's transverse because it's running in the transverse plane there. The superficial one is more like a band. That's usually how it's illustrated, and I've seen it like that on cadavers. Okay. Now the erector muscles are shown too. Now the erector muscles are, like the male, they got the same names. You have the bulbospongiosus, the bulbospongiosus in females, we noted this earlier, it remains open right there. Here it is on one side. They cut it away so you can see what it covers. That is the vestibular bulb. Covers vestibular bulb. It's erectile tissue. In the male, it's the bulb of the penis. So in females, it's vestibular bulb. Now the function of it is, since it's erectile tissue, it fills with blood. And when it does so, it compresses a gland. So it fills and then compresses the greater vestibular gland. When you compress the greater vestibular gland, there's a secretion that will lubricate the area during sex arousal. Secretion lubricates. Now the gland isn't shown on this picture. We'll try and look for it in other pictures and on models. But anyways, that's the bulb. The gland would be right down there. It's just, I don't know why they didn't leave it in there. The other thing is that The cavernosus muscle, it covers the crust of clitoris. Cavernosus covers crust of clitoris, just like the crust of the penis. So this is also erectile tissue. It's the same difference. Some people think that the clitoris is like the male penis. Well, it's erectile tissue, but the male penis carries urine. This doesn't, so I don't think that really matches up. Well, anyways, here and there are the crusts. The little tip there is the glans penis. I'm sorry, the glans clitoris. Okay, so yeah, crust of clitoris. What is glans clitoris? Which is the glans penis in males. But there's also a body of clitoris. Now the body's not shown, it's right behind the glands, but the crust, glands, and body of clitoris are on your study list. So I want to move on from this picture. If you put the skin back on, this is the view of the obstetrician. And I'm going to teach some of the other structures there. So the basic anatomy is, let's start with the mons pubis for this picture. It's just the top part, it's the skin over the pubic bone where you have pubic hair, right? That's why they got his name. I'll just put pubic hair. That's basically what you see there. Now on the sides you have the labia majora, skin with hair follicles. Labia majora is plural. You got two of them. If you ever see the term labium majus, that's singular. Skin with hair follicles. The function is basically protection, cushion. Okay, there's subcute tissue under that. The labia minora are hairless. Okay, the labia minora, if you reflect them back, you can see they contain a space called the vestibule. So labia minora is plural. So labium minus is singular. They contain space known as vestibule. And pretty much their general function is protection. They protect the vaginal orifice and the external urethral orifice. So that's what I'm writing. Protect vaginal orifice and external urethral orifice. Think of the vestibule as the space in front of these orifices. You can see the clitoris at the top there. Really, that's the glans clitoris. And the skin over it, like the foreskin of the penis, that's called the prepuce, but I usually don't test you on that. Okay, let's move on. Here's a picture. Let's look at this one here. This one is our model. And I took this picture, that's my hand, and I wanted to show you some of the muscles there. Turn the lights off. That's the deep transverse perineal. So that's superficial transverse perineal. These two heads are of ischiocavernosus. That's bulbal spongiosis right there. Okay. On this side, it's similar. They left the subcube on the deep transverse on this side, so you can't see it. But these two numbers are the labia minora and then labia majora. Okay, that's why I took that picture there. When I revised this yesterday, I decided to not hold you responsible for the muscles of the levator ani, so you might want to note that. You don't have to study that for the test. Not responsible for levator ani. I used to teach it because it supports the pelvic viscera, but it doesn't have a direct function in reproduction, so I dropped it. Let's look at this picture here, labeled. So again, you don't have to know 17 ABC, that's levator ani, but this stuff down here you still got to know. This does show glans clitoris, body of clitoris. Glans clitoris, body of clitoris. I just called it clitoris, but do know glans and body. There's a vein there. I think on one of my study guides I may have mislabeled that, calling that the body. But this is the body. This whole thing is clitoris, just glans and body. You can't see the crust because you need to see the lateral part of the pubic bone, and this is just showing you right in the middle. You also can see the labia, majora, minora. You can see the deep transverse perineal, this membrane right there. You can also see how, turn the lights off again. You have two canals going through. Vaginal canal, making that the vaginal orifice. And this is the external urethral orifice, making that the urethra, going through the UG diaphragm or the deep transverse perineal. So that's what you can see there. This is the rectum anus. We're not concerned with that now. So I want to move on and talk about the viscera. Here we have a picture of the ovaries. Now this picture was dropped from the book, but you still have it on your PowerPoint slides. Okay, this is what we're concerned with. Uterus. You have bladder in front, rectum in back. There are the ovaries right there. Let's look how they're supported. All of this is covered with peritoneum, so that when you look at it, when you cover it with peritoneum, it drapes all the way down and it covers everything. And if you take a slice right through there and look at it from the side, this is how they generate this picture there. So what I want you to know, all of these pinchings, where it pinches around a structure and then pinches underneath it or above something, those are called the broad ligament, and there's 3 parts to it. So these are supportive structures for the ovaries and the other things. The broad ligament is really peritoneum that covers and pinches structures. Now, what it does is, when it covers the uterine tube, when it pinches underneath, you call that part of the broad ligament the mesosalpingus, right there. Now the mesosalpinx, salpinx means trumpet because the uterine tube looks like a trumpet. This is just the part of the broad ligament. It looks like it's underneath the uterine tube, inferior to uterine tube. If you look at the part of the broad ligament above the ovary, that's called the mesothelium. So it's just superior to the ovary. Superior to ovary. And then on the lateral aspect of the uterus, this right here, that's called the mesometrium. Now the mesometrium provides like lateral support to the uterus. So those are the three parts of the broad ligament. I thought that this model shows all three the best, and I label it there. Mesosalpinx, mesothelium, and mesometrium. Okay, you can kind of see where there's kind of an angle. The angle's away, so it's mesosalpinx, mesothelium, mesometrium. The uterus itself, when it's covered with the peritoneum, it creates these little pouches in front and in back. And I teach these in the female, but not the male, because males do not have a uterus. So you should identify this little pouch as the vesico-uterine pouch, and this one as the recto-uterine pouch. Okay? One in front, one in back. I'll just list them on the board here. Vesico-uterine, recto-uterine pouch. By the name, you can remember where it is, because recto refers to rectum, and vesico refers to the bladder, which is the vesicle for urine. Okay, so be able to identify those. If you were to remove the uterus from the pelvic cavity, and then straighten it out and cut right through the frontal plane, you can view the thickness of the uterine wall as well as the uterine cavity. Okay. I'm going to change my battery. I'll be right back. Alright, business. I want to teach you the regions of the uterus. It's like an upside down, pear-shaped type of an organ. Well, the main function is to receive the blastocyst for implantation. It's where you'll carry the baby for, well, 38 weeks. All right, the top part is the fundus. So we point to it. The fundus of the uterus is the superior round part. They point right there. It's all this upper part. Now, inferior to that, most of it is called the body of the uterus. But anything that's called body of something, it's most of it. So most of it goes from the top, just below the fundus, all the way down to where it constricts. Right there is the next part, called the isthmus of the uterus, okay? It's the part where it constricts. Isthmus is narrow region. Hard to say. Isthmus. To help you identify it, look for, well, it doesn't always show as a constricted part in our models, but it's at the same level of internal os. Os is an opening. And so think about letting sperm in. That's one opening right there you got to get through. So the internal os is the opening, but that whole region is the uterine isthmus. So this, anywhere below that is cervix. The inferior 1/3, the quote unquote neck of the uterus, cervix means neck, it's the cervical uterus. Just call it cervix. Cervix is known well enough. You don't have to say cervix of uterus. People know what the cervix is. Inferior 1/3 of uterus. That's how I'll describe it. It's the cervix. It's the junction where uterus meets vaginal canal. Okay, so that's important to know. Because inside there you have, the sperm must swim through first the external os, cervical canal, internal os. This is all inside the cervix. And the cervical canal, when it dilates enough during labor and delivery, that serves as the birth canal with the vagina. Dilates, birth canal. Baby's head must fit through there. And so, in terms of fertilization, sperm must swim up through there, okay, to fertilize at the ampulla. In terms of labor and delivery, baby's head must fall head first through there, forming the birth canal. Okay, I'll stop there, and I want to start to tell you how to study for today's lab. There's nothing to turn in for today's lab, but I at least want to show you some of the study guides that I've uploaded yesterday. So think of today as the start of you studying for the lab practical.